always say time is hair, so don't waste it. Hello, I'm Dr. Angelo Landriscina, and I'm a board-certified dermatologist. Looking for medical information online could be unreliable or anxiety-provoking, so today I'm going to be answering some of the questions that might be getting under your skin. Are there any products or treatments for thinning hair that are actually legitimate? Yes, absolutely. Hair loss is one of the most common conditions that I see as a dermatologist, and part of the reason for that is that everybody will experience it at some point if we're lucky enough to grow old enough. The primary condition in which we see hair thinning in most people is something called androgenic alopecia. And really, it's more of a trait than it is a condition or a disease process. It is kind of complex because it does have to do with our genetics. However, the basis of it is that as we grow older, the actual hair shafts on our head become thinner and thinner and smaller and miniaturize until they become what we call vellus hair. That's like the peach fuzz that you might see on other parts of your body. Some of the products or treatments that may work for this kind of hair loss include minoxidil, which is available as an over-the-counter drug in the United States. It's also available as an oral drug by prescription, and part of the way that that works is by lengthening the growth phase of the hair, meaning that more of the hair on our head will be growing at any one time. And also it results in a thickening or a conservation of the diameter of the individual hair shaft. So essentially doing the opposite of what androgenic alopecia does. There are other procedures that could work, including something called platelet-rich plasma injection. That's when your provider draws some of your blood, extracts part of it that's rich in growth factors, and then injects it back into the scalp. However, what I would caution people about is automatically going for a treatment, a supplement, or an over-the-counter medication without knowing why their hair is thinning. There are some disease processes in which hair loss can be progressive or cause scarring. And once hair tracts are scarred over, there is no chance that hair will grow in that area again. There are also medical conditions like vitamin deficiencies or chronic inflammatory diseases that can cause hair loss. So what I always tell people is if you notice your hair thinning, definitely try to see a dermatologist if you can. Even discuss it with your primary care doctor, because there may be some underlying medical condition that needs to be addressed. Also, time is of the essence. The earlier you get treated, the more likely you are to preserve your hair. I always say time is hair, so don't waste it. Stress-related hair loss after giving birth. These are really common things that people do notice. This can quite often be due to a condition called telogen effluvium. I know that's kind of a mouthful, but essentially what it is a mass shedding of the hair following a specific event. Now, it could be a stressor. This is something that we saw a lot during the pandemic because things like high fevers or severe illness could cause this. And usually what happens is after the stressor takes place, it takes a few months to notice the hair shedding. Other things that could cause it are obviously psychological stress. And the most common condition that we see it is in post-pregnancy. You know, that classic idea of having gorgeous hair during pregnancy. And part of the reason for that is that most of the hair stays in its growth cycle due to the hormones. So yes, during pregnancy, you may notice that your hair is thick and luscious. And then after you give birth, you may notice that your hair is starting to come out in clumps. And that is the hair cycle of the different hair shafts kind of normalizing. Are there treatments to help with this? Again, I don't want to sound like a broken record, but topical minoxidil is one of the great treatments that we have for this. I would say, again, this is something to talk about with your specific doctor, and I always advocate that people talk to their doctor before starting any over-the-counter medications. If you're starting to see gray hair in your 30s, are you going to be completely gray by the time you're in your 40s? I wish I could tell you. Hair graying, just like a lot of other features of our skin, hair, and nails, is something that's partially genetically determined, and interestingly, as we're learning now, probably related to your environment too. For a long time, it's been suspected that stress could cause hair graying. There is new data, though it is kind of low-level data, showing that stress can be correlated with seeing gray hair. Decreasing your stress may reverse some hair graying, which is really interesting to me. I know that it's difficult to say, hey, decrease the stress in your life, but it may be a way to prevent more hair graying. I know a lot of people pluck their grays. However, if you overpluck your hair, like that hair may never grow back. And eventually when your entire head is gray, maybe you'll miss those hairs. Your hair will look a little bit thinner. Dyeing is definitely an option, but it does come with potential downsides such as, changes in your hair texture, damage to the hair breakage. If you're not particularly sensitive to hair dyeing, it shouldn't be a problem. There are some new products on the market with peptides that have shown maybe a little bit of promise when it comes to turning back hair graying, but I'm not really convinced yet that that's an across-the-board solution for everybody. No wrong answers, except don't pluck them. How to work out regularly, keep your hair clean, not overwash it. I wish there was one good answer I could give everybody, but there's not. It's gonna be a little bit of a trial and error process. Depending on your hair type, washing your hair every day or after every workout may not be feasible. It could lead to dryness, breakage, and other issues with the hair. There are some tactics you can use to extend the life of your hair wash, even if you're working out regularly. The first is using something like a dry shampoo, which is gonna absorb some of the oils on the scalp and help to keep the hair cleaner between true shampoos. Take a little bit of caution with that, just because overuse of dry shampoo can lead to some issues with hair dryness and breakage itself. Also keep in mind that you're supposed to be removing as much of that dry shampoo as possible. The way that you could do that is either brushing it out through the hair, or another way to do it that might be a little bit easier is using a blow dryer on the cool setting to just kind of blow it out of your roots. In addition to that, it is possible to actually just wash your scalp and not wash your hair. It is a little bit of a challenge, but if you're able to get in there with something like a tint bottle that's used for hair dyeing and just get some of that lather on the scalp, wash it out without really fully washing the lengths of your hair, that could be an option too. I hope this has been helpful. However, keep in mind, everybody's different, so make sure to check with your own doctor who knows you before making any changes. You can find me on all social media at Dermangelo.